Hey there, everyone, and welcome back to Studying with Stephanie. Today, we're going to continue our discussion in our connective tissue series, and we're going to talk about ligaments. So, what is a ligament? Well, a ligament is a dense, regular, and fibroelastic type of connective tissue. Again, denseness means that those collagen fibers are closely packed together. It's a really kind of close bundle of tissues. Regular means that the collagen is lining up in a linear fashion. And then the fibroelastic aspect means that ligaments can stretch, but not a lot. When we go into the actual components of the ligament, we see that the ligament is composed of about 20% collagen fibers and 80% matrix. Within the matrix itself, 66% of this matrix is water. When we talk about the collagen itself, about 85% of the collagen is type 1 collagen, with the rest being type 3 collagen. Like I said, because ligaments are fibroelastic, there is some elastin in the ligament, but most ligaments only have about 1% elastin. But there is an exception when it comes to the nuchal ligament and the ligamentum flavum, so that we can allow for those spinal vertebrae and those spinal processes to flex and move a little bit more. There's a little bit more elastin in those tissues. The function of a ligament is to connect bone to bone. With that being said, because a lot of our bones have hyaline cartilage on the ends of them as they are synovial joints, the ligaments also do adhere into those cartilage fibers as well. Ligaments are there to resist, to limit, and to control tensile loads. And they do this by tightening up or loosening up in directions of forces. So depending on where they attach and what their function is, that's when they're going to either loosen up and allow for some motion, or they're going to tighten up and resist motion. Typically, the ligaments are named for the bones that they attach together. So it's very kind of easy for us to understand where these ligaments are in space when we talk about the coracohumeral ligament, the coracoid process to the humerus. Pretty plain and simple there, okay? So with the resistance, the limitation, and the control of these tensile loads and the ligament's ability to either tighten up or loosen up to allow for some motion, ligaments also do guide some motion. If you think of that screw home mechanism within our knee, the ligaments are going to allow for that rotational aspect at the end range of knee extension. And then that beginning part of knee flexion to allow for the joint to get more congruent or less congruent depending on what the needs are for those specific motions. Because of that as well, the ligaments hold the joint together while they're guiding the motion. So they do not allow for those minor excessive little motions. So as we're moving through motion, we don't want all of this to happen as the muscles are pulling on the joints. So the ligaments are going to hold stable and allow that motion to move smoothly through our ranges. Ligaments also provide proprioceptive feedback because they do have sensory nerves within them as well. Like I said, they attach into those joints and the joint capsule itself, and so they're going to provide our brain and our spinal cord with feedback to understand where is our joint in space. Similar to tendons, ligaments do not have a lot of blood supply, if any, in the mid-substance, so that middle portion of the ligament. Differing from tendons, though, the ligaments have a lot of blood supply at the distal and proximal ends of the ligament. This is true with exception to the intra-articular ligaments because they are within the joint, and again, that joint gets nutrients through synovial fluid, not blood supply. The ligaments within the joint, the intra-articular ligaments, do not get blood supply, therefore do not have good prognosis of healing. That's why they typically need surgeries to be done to heal those ligaments and reattach them. The extra-articular ligaments, though, the ligaments outside of the joint, do get a lot of blood supply on the distal and the proximal ends of the ligament, and that allows for better healing through the tissues. The ligaments go through the same phases of tissue healing as the connective tissue proper. So if you want a little bit more in-depth discussion about tissue healing when it comes to the ligaments, go back to the connective tissue proper video. We're going to go through the same 3 phases. The inflammatory phase, which is that initial injury, immediate to about 2 days after the injury, where we have the release of the histamines and the cytokines, and the body is starting to understand that there was an injury to the tissue, and so it's going to release some fibroblasts into the tissue to start laying down new, good tissue so that it can start that healing process. Then we go into that proliferative phase, and with the ligaments, this is anywhere from the 2 days after the injury to about 6 weeks after the injury. Proliferative phase, again, pro-life, we want to restore some new tissue, bring some new life to the areas that were injured. As your body has begun the cleanup process, it's also going to begin to lay down new tissue. During this phase, the collagen is laying down in an unorganized fashion. So it's so important for us to start moving these joints in the proper direction of motion so that the force and the tensile loads can start to restore as that collagen is laying down in proper alignment. All right. When it comes to ligament injury, again, the ligaments, just like the tendons, are going to get injured when the load that is imposed upon the ligament is more than what the ligament can tolerate. So when we think about that stress and strain curve, we have that toe region where the ligament is able to have some motion without any damage or change occurring. Then we have that elastic limit where now we're getting into those ranges where if we're stretching the ligament, we're stretching it and it's going to stay stretched. It's not going to go back into that rubber band like fashion. And then we have that failure point at the top, the peak of that curve, where now the load is too much. The ligament itself cannot sustain that amount of force, and then we get failure. Now, when it comes to a ligament, we have rapid rate injuries, and these are those things that you see most athletes go to. It's on a field and they get a blow to their knee and they tear that MCL. Those rapid rate injuries where that load has overridden and has overloaded the actual ligament are going to cause tears to the ligament. But ligaments also do a unique thing where they can have avulsion fractures. The tendons can do this too. And this comes in when it's more of a slow rate and that load is gradually just increasing and increasing to where the ligament cannot sustain that load anymore, and it pulls and yanks on its insertion site and pulls some of the bone or the cartilage off. When we're thinking of that unhappy triad, the ACL, MCL, and the medial meniscus all get injured because those ligaments, they have such a close relationship to cartilage and to bone that when they get injured, they typically are not the only thing getting injured. So when it comes to an avulsion fracture, this is typically happening where those low sustained loads overcome the amount of tensile resistance that the ligament can sustain, and they pull off that part of cartilage or bone wherever that ligament is attaching into. We're going to go a little bit more into the length of ligaments. So after that 6 weeks, for about a year, 6 weeks to a year, the ligaments go through that remodeling and maturation phase. Because bone is the only type of connective tissue that lays down the same exact type of tissue when it's injured, ligaments lay down not only collagen and new ligament structures, they lay down scar tissue as well. So about 6 weeks of healing, we're going to start getting some of that tensile strength back around 5 weeks, which is great. We start to regain some of the strength and the tensile capabilities of the ligament. But we don't get 80% of that tensile strength back for about a year after the injury if there was no surgical procedure taken. So we got to really be proactive when it comes to ligament healing, because we have this time frame about 6 weeks where we're going through that remodeling and that proliferative phase, I should say, and the ligaments really need the guidance and the structure through exercise in order to lay down that collagen properly and give it the best ability to return to its tensile capabilities. About 3 years after injury, this is when the ligaments get about 100% of their restoration of their tensile capabilities. There are some studies out there that show ACLs can regenerate after about 3 years. And so this is why, as that body is laying down the new tissue and remodeling, and we're trying to get those loads to transfer and to absorb the forces that we are imposing on it, the ligaments take a long time just because they are that dense and they are linear structures and they don't have very much, if any, blood supply within the mid substance of that ligament itself. So it takes years to actually restore 100% of its strength. When we are also testing for ligament damage, we do have many different special tests. And there's different reliabilities of these special tests. There's different specificities and sensitivities of these special tests. But when it comes down to it, when a ligament is injured, we typically will have guarding as well as pain when we're trying to do these special tests. And this is going to limit our ability to truly detect what's going on in the ligament. So an MRI is the gold standard of detecting if there is a ligament tear. When we also talk about ligament injuries, we also want to note that hormones have a big effect on ligament capabilities because of the relaxin that gets released with pregnancy, as well as differentiating hormones when it comes to menstruation. Women are more susceptible to ligament injuries during these phases. Also, as we all go into middle age, our ligaments lose mass, they lose stiffness, they lose strength, and they lose viscosity, which again make us more susceptible to injuries. When we want to help to restore the ligament itself through the ligament healing phases, we want to make sure that we are providing early motion. Immobilization, just like middle age, is going to weaken this ligament. It's going to cause ligament deterioration, loss of strength, loss of stiffness, and it's going to hinder the ligament's ability to absorb loads and absorb forces in order for that tensile strength. So although we want to protect the ligament within that initial phases, we want to protect against undue stresses. As a physical therapist, it is our job, typically these people, when they're coming either after surgery or after an acute ligament injury, they're going to have a brace. And it's not to say that that brace shouldn't be on when that patient is out and about, but it's essential to educate your patients that we need to do these specific exercises because we want those ligaments to understand how to lay down new tissue, how to get stronger, how to stiffen up, and then provide that joint with the stability that that ligament is intended to provide for the joint. So with that being said, movement is essential. Again, as a physical therapist, you should know, as a physical therapy student or a physical therapy assistant student, movement, exercise, it's our bread and butter. It is what we do. We understand the small intricacies of what each of these movements are doing at the joint level, as well as how the muscles are activating through those motions. So it is our job to teach these patients what exercises are safe and what movements are safe, what is not. So we want to make sure that we are training in the lines of force for that specific ligament, that we want to restore the normal behavior of the ligament and increase the strength and the stiffness to the ligament itself through these exercises, so that again the ligament can provide that joint with the stability that it needs. We also want to, again, orient those fibers properly as the healing process is going on, so that the ligament doesn't get disorganized laydown of tissue, and then we get joint hypomobilities, and then we have a longer process to break down those hypomobilities, create that inflammatory response all over again for this patient, and then start to restore and facilitate the healing. So we want to make sure that we're educating why it's important to start early when it comes to these specific exercises, and why we're prescribing these exercises and not just any willy-nilly just go for a walk. Okay, there has to be specificity with what we're doing for each individual ligament, because of how the fibers are laid down, the orientation, the stiffness, and the function of what that ligament needs to do for the person as they're moving. When we are facilitating the healing process during that proliferation phase, cyclic loading is a really great way to help get this ligament strength and stiffness. And cyclic loading, if you're not familiar with it, is when we're providing the joint with a little bit of pressure and then unloading, pressure, unloading. So that way the synovial fluid is getting pumped in and out of the joint through all of the cartilage, and the joint is now understanding, this is my function. I need to load and unload. So the knee joint, for example, a great way to cyclically load the knee without putting too much pressure is the bicycle. So we're going to put a little pressure on, take a little pressure off as we're going through that repetitious activity, which is great to help with the stiffness and the strength of the ligament. And that's also going to help that scar tissue strengthen up within that ligament, so that again we can try and restore the stability to the joint. All right, so that's ligaments in a nutshell. We are going to continue our connective tissue series, and we're going to go more into muscles as well in the upcoming videos. We have some videos on cartilage, on bone, on tendon, on connective tissue proper. So if you need some more information on those and the healing properties and injury when it comes to those types of tissues, please go back and watch the videos. If you felt like this video helped you, please like and subscribe and share with your friends. And then if you need any one-on-one tutoring, or you want me to go over specific types of physical therapy assistant type of topics, please drop it in the comments below. I'm here to help you. And if you need one-on-one tutoring, like I said, leave your info below. I will reach out to you. Thanks so much for coming to Studying with Stephanie, and have a great day.